coming. I have some form I need you to complete for me, so you can have a seat and I'll bring you in as soon as I get around.
Thank you. Okay, so I've noticed this for a while now.
Okay. So you have a bunion.
I do. My grandmother has it too. It's not horrible, but it is an eyesore and it does bother me sometimes when I'm in heels, which I am a lot. I think just the procedure itself scares me a little bit. So
Understood.
what exactly would happen when I go through this?
Okay, so what I like to do, I'm going to put your foot up here so at least you can see it. In surgery, I make one stitch about this big. It's about less than maybe 5 millimeters. And what I do is I use this machine, which is a real-time x-ray machine. So here's your picture of your foot, just so you can see. This way I can explain your bunion better. Now in this x-ray, the black is the air surrounding your foot, the white fuzziness is your skin and muscles, and the white area is the bone. This space here is your joint, and so if you follow your bone up, you can see how this bumps out. And this is your bunion, okay? So in surgery, I make the one small incision on the side of your foot, which you then can see, this is a pen, but it's very similar to the actual procedure. I use a metal burr instead, and then this part is shaved off, so I can go in and just go straight up and just shave that part right off under x-ray. That way you can see. Now afterwards, you can go back into your shoe as early as 5 days.
Okay.
Your stitch comes out at about 1 week. You'll still have some swelling, you'll still have some pain, but you'll be able to kind of go back to your normal activity, even working out about 2 weeks.
Okay.
Running, I'd say usually about 2 to 3 weeks, it depends. In your case, you also have a sloping up of the big toe. That can also be done. I use a small eye scalpel. I usually make 3 small incisions sometimes like this, and this could be lengthened your tendon. So your tendon looks kind of like this, and I can notch it on the side, and it will make a Z, and it will automatically bring this part down. Sometimes, in your case, in this point, you don't have to because your toe is not that crooked here. Looks like the joint's pretty good. And sometimes other people, I make one small incision in between here, and I can use that to shift this out, or even in your case, it can even sometimes shift your bone over this way. This one is a MIS, is a minimal incision surgery blade scalpel, and it's used, it can make very tiny incisions and cut things that you need. This hand over here is the more traditional scalpel, and as you can see, there's a big difference between the size of the blades. This way the incisions can be made without any stitches with the smaller scalpel versus the larger one, and that way you have smaller incisions, less scarring, less pain. That way it can make you heal faster as well. Afterwards, after the procedure is done, once your stitches come out, I'll actually laser your scars. I don't charge people for that. It makes your scars much better, makes them heal better. It will help you get back to normal faster as well. That part works really well for people. You can come as much as you need to. It's usually once every 2 weeks. The laser doesn't hurt, and that way it can make you scar better. It usually takes about a minimum of 6 lasers to get you, 6 treatments to get you kind of much better scarring at that point.